These aren't the same legs I walked in on. That's what an 86-year-old lady told us yesterday, and it was so exciting to see because she came in really afraid of falling and very unstable. And so we started adjusting her and doing exercises for the brain. So one of the exercises for the brain, or all the exercises for the brain, we're working on the cerebellum, which is in the back of the brain. It deals with balance, coordination of movement, and muscle tone. So we put a headband on her, and it had a small laser on the front of the headband, and then we have a diagram on the wall, and her job was to move her head so that the laser followed the diagram on the wall, and that helps retrain the cerebellum for balance, coordination of movement, and muscle tone. Then we had her hold out her thumb and turn her head right and left while she kept her eyes on her thumb. And then we would do some light balance exercises with her and some exercises like she was writing an alphabet with her hand in big letters. And those were some of the exercises that we did with her. And then when I was adjusting her, we would use light therapy on the cerebellum with our GRT light to activate the nerve fibers there. And then we would do things like I would have her close her eyes. I'd push her a little bit to one side just lightly, and then I'd see what misalignments showed up along the spine and adjust those. And I'd push her another direction, and I'd push her forward, and I'd push her back just lightly to make her body try to maintain balance, and then we would make a correction. And so after just twice a week for 3 weeks, she said, these aren't the same legs I walked in on. And so she's so excited to have better balance and better coordination and not feel so afraid of falling. So if you know somebody like that, they may be younger or they may be at her age at 86, that's really having a difficult time with their balance, get them a consultation in our office and let's see how that we can help them. And maybe they too can say, these aren't the same legs I walked in on.